and I want to start out today a little different. Mike Rounds is not here today. We all know that Mike's wife has been fighting cancer for a good part of this year and maybe long before that. But she passed away yesterday morning, and I just want to, we argue, we fight, we do all this stuff here, but in the end, we're a big family. And I just want to let the folks out there know that Mike Rounds is an important part of this committee, and our thoughts are certainly with him and the Rounds family today as they prepare for the future. I want to thank you all for joining us today to discuss the collaborative efforts of the Department of Veterans Affairs and Defense to meet the needs of our military and veteran communities. Today we will hear from the co-chairs of the Joint Executive Committee, the Honorable Donald Remy, Deputy Secretary of Veterans Affairs, and the Honorable Gil Cisneros, Undersecretary of Defense for Personnel and Readiness. As co-chairs of the JEC, their job is to lead interagency cooperation between the VA and the DoD. They partner on a number of initiatives, including the delivery of health care and benefits, the military to civilian transition, and health data interoperability. This interagency work must be a consistent collaborative effort. Our service members and veterans depend on it. One of the most critical intersections of the VA and DoD's responsibilities is ensuring the seamless transition from DoD to VA healthcare. This requires health exams upon separation that are comprehensive and that can be used to inform post-service treatment and to determine eligibility for benefits before they leave the service. But a service member's transition to civilian life extends beyond just health care and benefits from the VA. Choosing a next step after the military, whether it be education or employment, requires guidance from the VA and the DoD on what makes the most sense for that service member and his or her family. VA, DoD, and Department of Labor all have a role to play through the Transition Assistance Program in ensuring these men and women are prepared for life after service. This stressful time places significant strain on a veteran's mental health. In Congress, we've made some strides in the provision of mental health care to our veterans, including passage of the Commander John Scott Hannon Act. Now VA must do its part to implement. But the DoD has a role to play, particularly in the development and deployment of joint mental health programs. And I want to applaud the Biden administration for releasing a new strategy on veteran and military suicide prevention just yesterday. I look forward to working with your departments on this shared mission. VA and DoD are also on parallel paths in deploying the Cerner electronic health record. Both departments' programs have had their setbacks, and it's important for the VA to learn anything it can from DoD's challenges and successes as they implement reforms coming out of Secretary McDonough's strategic review. Another critical area for action is toxic exposure. Right now, it is far too difficult for veterans to prove they were exposed to toxic substances. New programs like the Individual Longitudinal Exposure Record, or EILR, will enhance VA's access to DoD records on exposures. But that information is only as good as the DoD's record keeping. Collaboration between your agencies goes beyond preparation for transition and service members' records. It also includes shared facilities and supply chains. And as you continue working to improve the lives of service members and veterans, there are opportunities to save taxpayer dollars through joint purchasing power. We will cover these topics today with Undersecretary Cisneros and Deputy Secretary Remy. We will also hear testimony from community organizations who partner with the federal government to assist our nation's veterans. These groups experience the collaborative efforts between these two agencies firsthand, both their successes and their failures, and their on-the-ground perspective is absolutely critical. With that, I turn the mic over to Senator Moran.
I would take what you said first. I'd turn the chair over to, but in the absence of that, I'll take the mic.
Well, that's been happening far too often.
Mr. Chairman, thank you for conducting and holding this hearing. Both secretaries, welcome to the Senate Committee on Veterans Affairs, and thank you for your presence with us today. And Mr. Chairman, thank you for your recognition of the sadness that's occurring that has occurred in the Rounds family, and I too join, all of us join you in offering our sympathies and condolences to Senator Rounds and his family and the loss of his wife. What a tremendous family, and we're all saddened today. This hearing is an excellent opportunity for us to discuss the current state of affairs between the VA and the DoD and their collaboration efforts, especially regarding how to better assist service members and their families that are transitioning out of military service into civilian life. I want to highlight the words I've noticed that are consistently used throughout the last 10 iterations of the Joint Strategic Plan to describe the JEC's goals for transition: collaborative, comprehensive, personalized, interoperative, seamless, and efficient. However, when conducting oversight of the transition process, we continue to witness a fundamental problem of DoD and the military services balancing military readiness with prioritization of a service member's post-military readiness and entrance into civilian life. I'd be remiss if I didn't remind the Undersecretary Cisneros today that supporting a successful transition to a civilian life is a vital recruiting tool and impacts our nation's ability to sustain an all-voluntary force now and in the future. The military is known to invest a lot of effort and resources into training and developing leaders while they are in uniform, and it should be everyone's mission to ensure that veterans are given the opportunity to use these positive attributes to give back to their communities after service and to benefit themselves and their families. I look forward to hearing from the second panel as well. Your organizations represent the gold standard for how community programs can be maximized nationwide. It is my hope that both departments here today will listen closely and find value, as we will, in your testimony. Lastly, I'd like to discuss the impact of the vaccine mandate, what that impact has been, what it will be, and I'd like to know what it will have on the operations of and eligibility for services, as well as the readiness levels at DoD. I look forward to hearing from you about the impact of the mandate on an individual's character of discharge and eligibility for VA benefits. Thank you, Deputy Secretary Remy and Undersecretary Cisneros, for being here today on behalf of VA and DoD. And Mr. Winkle, Dr. Armstrong, and Mr. Hutchins, I want to especially thank you for your work as you continue to do so many good things on behalf of veterans in our communities across the country. Mr. Chairman, again, thank you.
Thank you, Senator Moran. And we'll start with the first panel. I want to welcome co-chairs of the JEC to the first panel, Honorable Donald Remy, Deputy Secretary of Veterans Affairs, and Honorable Gil Cisneros, Undersecretary for Defense for Personnel and Readiness. Secretary Remy, you can start.
Chairman Tester, Ranking Member Moran, and distinguished members of the committee, good afternoon to all of you. I too would like to start and offer my condolences to Senator Rounds and to his family on the loss of Jean. I pray for the family's strength at this moment. I want to thank you for the opportunity to appear before you with my colleague, Undersecretary Gil Cisneros, to testify on Veterans Affairs collaboration with DoD. And I want to thank you for your strong support of this work. To begin, however, I want to touch on concerns related to the supply chain, which I heard mentioned in the opening comments, and let you know that we're ready to deal with those challenges. The pandemic exposed global and U.S. supply chain weaknesses, and we expect the manufacturing and distribution disruptions to continue. As the virus spread, overall consumer demand decreased and industrial activity in turn decreased. With the increasing level of vaccination globally and the end of lockdowns in many nations, however, consumer demand has increased dramatically, while supply chains continue to face big challenges, including worker shortages and limitations in access to raw materials and key components. VA is actively addressing these challenges, implementing near-term methods to ensure internal VA supply chain resiliency, including monitoring the ability of our suppliers to fill orders completely and timely, identifying alternatives for preferred products, and treating medical products as enterprise assets. We know that effective national response requires a durable public health supply chain anchored in domestic manufacturing so that care and preventative measures can reach our veterans. Sustaining that supply chain is critical for ensuring the health and the wellness of the nation, as well as for national security, and VA is working closely with the White House, with all executive branch agencies to develop and implement the actions identified in the National Strategy for a Resilient Public Health Supply Chain. Bottom line here, those challenges are very real, and we're mobilizing to address them. I want to focus on our collaboration with DoD, and thank you for that word, Senator Moran. During my confirmation hearing in May, I committed to ensuring that VA has a strong relationship with DoD, to ensuring that we have long-term strategic approach and resolve all of our challenges together. And I committed to efficiently and responsibly using the resources that you appropriate for us. After about 3 months on the job, here's what I can report. Our direction is clear. We're guided by the needs of service members and our veterans. Our partnership is strong, and we're on the path to grow stronger. Secretary Cisneros and I are devoted to improving the delivery of health care, benefits and services, and transition support for those we serve. We recently signed our VA-DoD Joint Strategic Plan for FY 22 through 27 that shifts us from a 3-year to a 6-year planning cycle. The plan establishes our shared vision and 5 goals critical to caring for service members and veterans as well as they have cared for us. It's our charter for the future, our contract with those we serve, and we're completely aligned on what matters most, fulfilling our nation's sacred obligation to keep our troops safe when we send them into battle, I should say, and to care for them when they come home. Fulfilling that obligation means collaborating effectively and efficiently on the health care that we deliver to the more than 18 million service members, veterans, and their beneficiaries. A patient-centered system delivering quality, access, and value seamlessly across our 2 departments. It means integrating benefits and services delivery across joint business operations, a beneficiary-centric approach providing excellent customer service, eliminating gaps and discrepancies in benefits, and improving communication with beneficiaries. It means helping veterans build fulfilling civilian lives with education and jobs worthy of their skills and service after they leave the ranks. That's enhancing the transition and post-separation experience with planning, services, and programs that ensure access to the highest quality care, benefits programs, and job training. And that's post-service placement at the right time in their lives' journey. It means modernizing our shared business operations with a joint approach and innovative technology solutions that gain efficiencies, avoid cost, achieve better outcomes for service members and veterans, all the while being good stewards of the taxpayers' dollars. And it means strengthening our interoperability and expanding our network of interagency and public-private partnerships to bolster our agility and promote operational efficiency, improving data interoperability, shaping policy, facilitating data-driven decisions, and enabling seamless experience for beneficiaries. Chairman Tester, Ranking Member Moran, distinguished members of the committee, we're committed to driving collaborative efforts to realize our shared vision. And Secretary Cisneros is a great partner in this endeavor. Thank you for your support and devotion to those we share this service, to those that have shared and served this country. I look forward to your questions.
Thank you, Secretary Remy, and please know for both of you, your entire written statement will be a part of the record. Thanks for being in the 5-minute time block. Secretary Cisneros, you're up.
First, sir, let me offer my condolences as well to Senator Rounds and his family. Chairman Tester, Ranking Member Moran, and the other distinguished members of this committee, thank you for the opportunity to appear before you today, along with Deputy Secretary of Veterans Affairs, Mr. Donald Remy, to discuss the important partnership between VA and the Department of Defense. We look forward to discussing our collaboration, including joint efforts on healthcare, benefits delivery, transition and post-service placement, interoperability, and efficiencies in operations. I'd first like to take a moment to say that I am proud and humbled to be leading this critical joint work in concert with VA Secretary Remy. As some of you may know, I enlisted in the Navy in 1989 and finished my 10-year naval career as a commissioned officer. It was at that time I first had my experience with transitioning from military to civilian life. Later, while serving in the House of Representatives, I co-founded the Military Transition Assistance Pathway Caucus to support and advocate on behalf of service members returning to civilian life in an area that I will continue to champion in my role as Undersecretary of Defense for Personnel and Readiness and as the co-chair of the Joint Executive Committee. I am passionate about this work, and I am motivated by what we can accomplish together. Strategic planning is the bedrock of our joint efforts and sets a condition for our collaborative work. It reflects our vision for the future and our enduring commitment to service members, veterans, their families, and caregivers. I'm also pleased to share that Secretary Remy and I recently signed the VA-DoD Joint Strategic Plan, charting our joint endeavor for the next 6 years. The VA-DoD partnership has never been stronger. Our roles and responsibilities position us well to ensure open and frequent dialogue, lead change, resolve conflict, guide joint actions, initiatives, programs, and policies. It may sound bureaucratic, but our relationship is anything but. We have already developed a meaningful, open-door cooperative relationship, which has yielded results, some of which I've highlighted in my written testimony. Military to civilian readiness, or M2C ready as we call it, is one area Secretary Remy and I are both committed to. M2C ready aligns more than 20 transitional programs, activities, and actions owned by multiple offices and agencies under an overachieving framework during the critical and officially designed transition period, which extends from 365 days pre to 365 days post-separation. Standardized assessments and exams, integrated programs, mental health touchpoints, and a new online single authoritative tailored statement of benefits are all components of this important framework that we continue to champion. Finally, interoperability and shared business practices are critical to increasing access and improving outcomes for our service members and veterans. As of September 2021, there are 147 active healthcare resource sharing agreements and 35 active non-medical agreements nationally. These agreements cover a wide range of support services, operating and integrated programs like the VA-DoD Integrated Disability Evaluation System. We continue to improve performance in other areas, including our effort to reduce the payment reconciliation timelines to 30 days or less between the departments. We also continue to advance joint IT architecture, a DoD-VA common identity, and enterprise-wide implementation of the electronic health record, a project pivotal to the future of VA-DoD healthcare. I am grateful for the opportunity to speak with you today and discuss VA-DoD collaboration and the Joint Executive Committee. Secretary Remy and I are committed to the collaborative efforts needed to realize the strategic vision laid out in the VA-DoD Joint Strategy. In closing, Mr. Chairman, I thank you, the ranking member, and the members of your committee for your steadfast dedication and support of our nation's service members, veterans, their families, and caregivers. Thank you.
Thank you, Secretary Cisneros, and thank you both. I will yield my time to Senator Brown.
Thank you, Chairman Tester, and thank you for your comments about all of your our colleague, Senator Rounds. Secretary Cisneros, I'll start with you. Yesterday, administration announced its military veteran suicide prevention strategy. I appreciate that two of the main topics addressed in the strategy are upstream risk and lethal means. Data released by the VA, the most recent I believe we have is for 2018, shows that in Ohio, 211 veterans died in my state of 12 million people. Two-thirds of those involved a firearm. I look forward to learning more about the joint public safety education initiatives among DoD, VA, and HHS and DHS. Senator Tester and I have been on this committee, the chairman and I have been on this committee since our first day in the Senate in 2007. We continue to hear about the threat of far too many suicides, or the incidence of far too many suicides. And it just seemed I don't understand why we're not doing everything we can to increase to make better the handoff between DoD and in the VA. Legislation I'm working on to create a pilot project in TAP to educate service members about these challenges and the impact on their mental health can help. But how are you going to address upstream risk? How are you going to, particularly for service members transitioning from DoD to VA?
Well, Senator, thank you for that question. One life by suicide is just way too many, and this is an issue that is important to the administration, the secretary, the deputy, and myself, as well as my colleagues at the VA, is how can we take better care of our service members and veterans when it comes to suicide. working through the JEC and working with DoD, the focus that we've talked about taking is really to focus on mental health, how we can do that, and ensure that the transition from when service members are coming forward with issues that they need support with their mental health, that those issues are going to continue to be treated, they're going to continue to be treated for those issues once they leave the Department of Defense and move on to the VA. That transition is something that I know is we are going to work collaborative on, and we know it's very important to make sure that those individuals receive the treatment that they deserve.
Thank you. Secretary Remy, actually both of you, if you would answer this. A couple of years ago, the Burn Pit Accountability Act was passed into law requiring DoD to evaluate service members for toxic exposure. I think most Americans know enough about what happened with Agent Orange and how long it took us to respond to it, and how most Americans believe that the military knew a lot more about exposure to Agent Orange and knew a lot more about the companies that were exposing our servicemen and women, and nobody took much responsibility or paid much of a price. Burn pits, not exactly parallel or analogous, but not too far off from that. Talk to me about your efforts to implement the implementation of this law. Start, I guess, with you, Mr. Cisneros, and then Secretary Remy, too.
Well, Senator, you spoke of Agent Orange and what the lack of effort there in the past, and that's something that's very personal to me. My father was a Vietnam veteran. He suffers today from side effects of Agent Orange, and that is not something that we want to see our service members have to go through again. We're moving on this. We have the EILR in place now to track where the burn pits took place, to ensure that service members who might have been in those areas, been exposed to those effects of the burn pits, that information is being tracked. We will continue to do that and ensure that is information that can be passed on to the VA, that once those individuals have been kind of identified as exposed to that they can ensure that they will receive the treatment that they deserve and that they've earned.
So if I were a service member about to leave the service, would I be asked about my exposures during my separation history and physical examination? Would I get asked those questions?
Senator, toxic exposure registry education and communication is being conducted at DoD. And again, the EILR is tracking the data and it's continually being updated. And we do have a working group working on this, but that information is collected, they are educated on it, and it is communicated to them.
Okay, thank you. I have another question. I'm sorry I didn't get to you. Director Ramey, I will follow up with a written question to you, and Mr. Cisneros, I want to follow up on that when I run out of time. But I mean, it's still pretty shocking to me when we expose so many servicemen and women to burn pits, and how higher ups at the military simply were not thinking that through about what that could mean for our men and women who served. And taxpayers are going to be paying for that for the next 30 years as we still pay for Agent Orange, even though we still haven't taken care of enough people. But worse than taxpayers paying for it are the men and women that have been exposed, and it's pretty shameful. Thank you, Mr. Chairman.
Senator Moran.
Chairman, thank you. The character of discharge, I'm going to direct this question first to you, Mr. Cisneros. The character of discharge for service members could potentially cause serious second and third order effects when it comes to eligibility for VA services and benefits. Mr. Secretary, can you explain to the committee your guidance to commanders regarding how to proceed with discharge when a service member declines the vaccine?
Senator, we see the vaccine as a readiness issue. This is something the Secretary has talked about. The service members right now receive 12 different vaccines that they're required to take.
I'm not really questioning at this point the desire or the intention to have people vaccinated. My interest is about the discharge for their failure to do so.
So the discharge is up to the individual service as to how they proceed with that. And that is how it's being handled.
And is there any guidance coming from DoD to those service commanders, the sectors?
Right now, sir, it's pretty much the guidance has been that it's within their realm to how they issue those discharges, and it's up to the services.
Has any of those commanders made a determination?
Sir, that I do not know. I can take that for the record as to what that will be. I do know the Air Force discharged 40 recruits recently, but they were left with the option to come back. If they did receive the vaccine, they would still be able to come back into the service.
Thank you, Mr. Secretary. Secretary Remy, tell me about what VA services and benefits might be impacted by discharges other than honorable.
Thank you, Senator, and that is a determination, as Secretary Cisneros just indicated, would be made by the service in terms of the nature of the discharge. If someone was discharged as other than honorable, we would look at their circumstances on a case-by-case basis. There may be an impact to their benefits. We would consider all factors before making a determination of whether or not there would be an impact to their benefits. Factors including mitigating or extenuating circumstances, supporting evidence provided by third parties, the length of service, performance and accomplishments during service, the nature of the infraction, and the character of their service at the time of their discharge. In an other than honorable discharge circumstance, there are some benefits that are available. Of course, crisis mental health care is available to all of our veterans, regardless of the nature of their discharge.
Mr. Secretary, it appears to me, based upon your answer, that the Department of Veterans Affairs has considered the answer to the question I asked you, and they're prepared what you just described as now a policy or a statement of the department, what its intentions are.
Senator, this is how we approach any discharge of any service member. There is a process that we go through in evaluating whether or not the benefits would be available. And what I described to you is the process that we use under those circumstances when someone has an other than honorable.
So it's under a broad range of circumstances that a discharge.
Yes,
those
sir,
are the
this is not
criteria, not
specific.
specific to this issue.
That's correct, sir.
Okay, thank you. Let me ask about transition. We've found there isn't consistency among installations regarding senior leader engagement in the transition process. Understanding that the readiness and training of troops is a #1 priority, a part of being able to sustain an all-voluntary force relies upon supporting those individuals during their service and after they take off the uniform. To you, Secretary Cisneros, can you opine on how commanders could be motivated to invest in facilitating access to all programs and counseling during transition? My point in my opening statement was that they're different from commander to commander and circumstance to circumstance. How do we engage the commanders in every instance?
Thank you for that question, Senator. You are correct. TAP class or the transition, when we typically think of transition, we think of the transition assistance program that members are required to attend before they separate from the service. And that really is different from command to command, installation to installation. That is something I personally, coming into this job, want to work on and fix about how we can make it more uniform, how we can institute that no matter where you go to TAP class, that it would kind of be the same class, whether you're attending TAP class in Fort Bragg or whether you're attending it down at 32nd Street in San Diego, Naval Station. That is one of the things coming into this job that I definitely want to work on with Mr. Remy, see how we can work on that through the JEC to make a more uniform TAP class.
Secretary Cisneros, my time has expired, so I won't ask a question, but last week in this committee, we heard from Dr. Arthur DeGroat. Art DeGroat is a Executive Director of the Military and Veterans Affairs at Kansas State University, someone the chairman called white hot smart. And what we learned was from your report that 80% of TAP participants found it useful. Good thing. But we learned from Dr. DeGroat that there is a lack of any true personal connection ultimately resulting it resulting in a pointing to a computer screen, to websites, and asking veterans to seek their own assistance. That's not a good circumstance, assuming that this white-hot, smart witness knew the facts of the circumstances of many. So I'd explore that with you to make certain that it goes back to this personal engagement that you indicate you are pursuing. It seems to me there's lots of gaps in that regard.
Yes, Senator, and again, this TAP class isn't perfect, but I will say where it's come and where it's going is a lot different. As I said, when I got out 17 years ago, it was basically you got to go to this, check the box, and move on. I think we've made a lot of progress since then, but I still think we have a lot of progress to continue to make.
I consider myself an ally of yours in accomplishing that.
Thank you, sir.
All I have to say, Senator Moran, is he was from Kansas State, as I recall, and anybody from Kansas State is white hot smart, right? Senator Hirono.
Thank you, Mr. Chairman. I'll just leave that last statement alone, I think. Let's not go there. Okay, so thank you very much to both of you. And making the transition from active to veteran status as seamless as possible is a really important goal. And so I applaud your efforts toward that. And one of the areas that we've long addressed was the ability of a service member to make sure that all of his or her health records go with him or her to the veteran status, and that's always been an issue because I remember commitments made many years ago between the VA and the DoD to effect this kind of capacity, and $1 billion was spent toward that goal, and I think we're only now reaching that point where we can talk about these electronic records. So as the VA, this is for Secretary Remy, as the VA moves forward with their own electronic health record rollout, as the DoD is doing, will the department be using feedback from DoD's experience to help determine best practices? And if so, are any of these best practices location specific?
Thank you for
Remy.
that question, Senator Hirono. And the short answer to that is yes. And we do that in a number of different ways. We have a group that's a DoD VA interoperability functional group called the FIRM, and the Federal Electronic Health Records Modernization group that supports both DoD and VA. And through that body, we are able to tap into the lessons learned from DoD in their prior deployment at all of their sites. And the information that's provided there can help us better prepare as we move forward in deploying the VA's electronic health record system. They're systems that are provided by the same contractor, so there are synergies that are designed to be achieved there. And what we're trying to do is to make sure that we don't make mistakes that have been made in the past, and if we do, that we quickly remedy them, that we can leverage the experiences of DoD and others in our deployment.
Well, we've all heard of veterans who have incomplete or piecemeal health records. So will this system enable tracking or going back to during their time in service to complete their health records? Is there any capacity in the system to do that?
That is the ultimate goal. The goal is to make sure that the records of a service member from the time that they put on the uniform to the time that they separate from service to the time of death are all captured in this system, that our clinicians are able to use those records in a way to provide the care that the veterans need.
I can see that going forward, yes, but what about all the veterans who are currently trying to find their records so that they, for example, trying to determine whether they were in any kind of environment that would have exposed them to toxic substances, and if, in fact, those records should even contain where they were deployed, where they served, so that if a health situation develops in the future and it can be connected up to some exposure that they had, that don't you think that kind of information should also be in the health records? Because you were asked about burn pits, and there have been many exposures that only much, much later has been determined to be detrimental, and a lot of our service members who wouldn't even be able to remember where they were deployed, where they might have been exposed to such substances. So in terms of the kind of information that gets put on the records, that's also important, don't you think?
Yes, ma'am. Senator Brown asked this question earlier, and I know Senator Tester mentioned it in his opening remarks, and my colleague Undersecretary Cisneros talked about EILR, which is a program that's designed to do exactly that, to track the locations, to track the exposure of service members from the time they're on active duty to the time that they become veterans. And we hope one day to make sure that the data and information through the EILR system is also put into our electronic health record system.
Good. Senator Brown also asked about the White House rolling out a new strategy for military and veteran suicide prevention that includes tailoring solutions to subpopulations where possible. I previously questioned the VA on suicide prevention efforts tailored to women veterans and AAPI veterans, both identified as high-risk groups. Has the VA determined the best way to tailor outreach to these high-risk subgroups? Are there, cultural competency training for ethnic and racial subpopulations? Are those deemed important components for the suicide prevention program?
They are, in fact, Senator Hirono. They are a component of the information that we provide to those veterans who are seeking, and information that we provide to even those veterans that may not necessarily come to us. We do it through our vet centers, through our medical centers, but we have determined that we need to make sure that we meet our veterans where they are, that we provide them the information that they need, and if it's information that's based on cultural uniqueness, we provide that information as well.
If I could just ask one more. So I hope that you have a matrix on this kind of outreach so that you have some kind of a basis from which you're operating, and then you can tell us how successful these outreach programs are in suicide prevention.
I can take that back, Senator, and make sure that we get back to you on that.
Thank you, Mr. Chairman.
I've got alternate parties. Senator Tillis, you're up virtually. 5, 4, 3, 2, 1.
Yeah, Ken, you got me? Hey, thank you, Tom. I appreciate that.
Senator Tillis. Senator
Go ahead.
No, Senator Tester, I was just saying that Bill got on just before
Okay,
you.
sounds good. Senator Cassidy, sounds good. Thanks for the clarification.
Thank you, Tom. So, Mr. Remy, great to see you, and so glad that you've been able to get into this position. I you've inherited some issues, so I don't want to pinpoint you as the person responsible for anything, but rather, obviously, you're now the person who for things past, but now we're talking about going to the future. We've had a lot of conversation in this committee. We put a lot of money for EHR interoperability between the Department of Defense and the VA. We had a hearing not long ago from the OIG, and he had some interesting thoughts. So, for example, he thought that the VA's approach to training employees on the new electronic health record, he said it wasn't thought through adequately. Now, knowing it takes two to tango, so DoD is also involved, concisely, please, what is the VA doing to better think through this interoperability with the EHR of the Department of Defense?
Thank you, Senator. It's good to be here. It's good to be with you, and it's good to be able to answer your questions. That OIG report recommendation was one with which we agreed, and since then, we've been working together with Cerner, the contractor, to build a better training program to assure that we provide the information that the clinician needs in order for this system to be deployed successfully. We mentioned—
Now, can I ask you, I don't mean to interrupt, we just have limited time. One of the specific, in my conversation with Mr. Case, was that doctors, nurses were initially involved in the workflows of the EHR, but they were not, quote, notably not involved in the design of the training and how to present the training to the clinicians. So as a physician, and knowing that ultimately the physician is a heavy user of EHR, and oftentimes the choke point in terms of moving patients through is the interaction with EHR, what has been done to improve this, if you will, the involvement of the clinician in the EHR?
Sir, we have directly placed the clinician in the process of developing the work streams to assure that the training is adequate and effective. We've enhanced our Office of Functional Champion, which is part of our VHA team that where the clinicians sit, and we've made sure that at every step of the way as we build the future success of the electronic health record system, the clinician's voice is heard in that process.
Now, when you say the clinician's voice is heard, if the clinician is not in the room and does not have the ability to say, this is not going to work, don't go forward with it, then really that is a voice, but it is a voice as a forest falling in a tree falling in a forest. There has to be some sort of authority given to that voice. Can you specifically mention the authority given to that voice?
Absolutely. The Office of Functional Champion, which is part of the VHA, which is where our clinicians rest, is now deeply involved and has authority to help build the training modules and to help deploy the system. And so to the extent that they're articulating challenges, issues, or circumstances where things just won't work, we have that data. They're part of the decision-making process. They're part of our governance structure. So as the decisions are made about how to move forward, their voice is not only heard, but their voice is part of how we make a decision as to which direction we're going to go in the future.
So let me ask you, let me change the subject. I'll go first to Mr. Cisneros. Senator Hirano was asking about suicide. And I previously learned that the peak suicide rate is within 6 months of separation. And I've been recently told that there has not been a significant improvement in veteran suicide rates despite the various interventions that have been implemented. Now, your testimony states that significant work has gone into creating a baseline well-being assessment administered by the Department of Defense to measure and address the service members' susceptibility to social pitfalls of transition. I guess, have you seen any, on the one hand, obviously work has taken place, and Mr. Remy, you may want to reply because the transition you speak of a year before and a year after post-separation, but so far there's not been improvement in suicide rates. Now you may tell me the first 6 months has decreased, and if that's the case, then I'd like to know that. But if the 6 month separation suicide rate has not gone down, what are we doing to look at these new programs and to see whether or not they need to be tweaked, et cetera?
Senator, I'll go first. I know the program that we're starting, the BWA program, to kind of look at this, how we can have that baseline start, is really just a pilot program right now that is beginning. We are looking to create that baseline so that we can move forward. But as Mr. Remy and I, Secretary Remy, we are both committed to this. We are working on this issue through the JEC, and we are doing, moving forward. This is going to be one of the top issues that we deal with, and really how we can put a dent in both suicide for our service members and our veterans.
Okay.
And if I may add to that, indeed, it is part of our strategic priorities that we've laid out in terms of how we're going to move forward and what we're going to look at and what we can collaborate on in order to make a difference for our service members and our veterans.
I'm out of time. I yield back. Thank you both for your service.
Thank you, Senator Cassidy. Senator Hassan.
Thank you, Chairman Tester and Ranking Member Moran, for this hearing. Thank you for the witnesses for being here today and for your work. And I also want to acknowledge the administration's recent announcement on military and veteran suicide prevention strategy, as addressing this issue is not only obviously a priority of mine, but as you can hear from our colleagues, a priority of all of ours. Undersecretary Cisneros, with that in mind, I want to start with you. This committee has focused on the tragically high rate of veteran suicide, but unfortunately, service members also die by suicide far too often. I want to talk about Sean Cloutier from Concord, New Hampshire. On 9/11, he was just turning 5 years old. It was his birthday. He was wearing his birthday crown when al-Qaeda terrorists attacked our country. Sean announced that day that he wanted to join the military. 14 years later, he did just that, signing up for the Army right out of high school. A few years after joining the Army, Sean attempted suicide. He received some medical attention, but not enough. And 2 months later, Sean died by suicide at the age of 22. His mother, Patricia Cloutier, is an advocate for suicide prevention among service members and veterans. So Undersecretary Cisneros, it's clear that the Department of Defense has to do more to help stop preventable tragedies like Sean's. You've gotten questions about this already from Senators Brown, Hirono, just now Cassidy, but can you discuss with more specifics how the administration's new suicide prevention plan would help current service members and what more the agency can do?
Well, thank you for that question, Senator, and really my sympathies are with Sean and his family, and it's a tragic story that we've heard about from one too many service members who have gone through this. I think the initial thing when I read that report was that I was excited to see that the administration first was just taking this as an initiative that they wanted to work on and putting it forward as one of their priorities. I think that alone is going to be something that's going to help move this forward. That's going to make it a priority not only for the VA and the Department of Defense, but for the entire administration and hopefully the entire country. I believe there's a section on there about lethal means that needs to be addressed as part of one of the reasons that this is happening. And so I think hopefully that we will focus on that, the lethal means, as part of why is this happening, and really kind of start to work on that issue as that being the number one means of suicide amongst our service members.
Thank you. Deputy Secretary Remy, I wanted to talk to you about the Solid Start program. I have a bipartisan bill with Senators Kramer and Cassidy that focuses on service members' transition to civilian life, and it strengthens the Solid Start program, which, as you know, is a VA initiative that the prior administration started. It's an initiative that requires contact to every veteran 3 times in the first year after they leave active duty to check in and help connect them to VA programs and benefits. Those contacts can help support veterans in any number of ways, including helping to address veteran suicide. I was pleased that this committee recently voted unanimously to pass this bill, and I will keep pushing to get it signed into law by the end of the year. Can you speak to the successes that you've seen with the Solid Start program for veterans readjusting to civilian life and how strengthening it will benefit veterans?
Thank you, Senator, for that question. And I too, am saddened by the story that you described when you were asking Secretary Cisneros this question. This is a really good program, and I'm excited about it. It has demonstrated to be very successful for our veterans and our community in terms of understanding what benefits are available to them and what resources are available. And so we've seen since the beginning of the program a significant increase in the use and effectiveness. As you know, we touch in with the veterans 90 days, 182 days, 365 days after departure, and that connectivity has been very beneficial to the veteran community.
Well, I appreciate that, and I look forward to working with you on that. I have 2 additional questions that I will submit for the record, one about the Transition Assistance Program and one about the impact of substance misuse disorders and opioids in particular for our service members and our veterans, and I'd look forward to working with you both on that. Again, thank you for being here. Thank you, Mr. Chair.
Thank you, Senator Housen. Senator Bozeman.
Well, thank you, Mr. Chairman. Thank you all for being here, and we appreciate the role that you play in helping our service members transition, which is so very important. Mr. Cisneros, in 2017, the budget included roughly $31 million for transition assistance compared to $100 million in unemployment benefits for transitioning service members. Is the SkillBridge program something DoD can leverage to partner with industry and community nonprofits to provide job training and credentialing programs for transitioning service members and spouses?
Senator, thank you for that question. The SkillBridge program is a popular program. It has support within DoD, has support amongst the services. It definitely is one that I think we can continue to grow. We've tried to make it more uniform now, or there's a website where individuals can go out there and search the different programs, the different opportunities that are out there for them. I think here at the JEC, and what we can do more is really within DoD is try and bring more businesses into that to provide more opportunity. But it is a program, and it really is something that a good part of helping individuals transition from military life to civilian life.
So currently, the VA's data only captures veterans in the VA system, leaving out a significant part of the veteran population. To fully understand this population's needs and challenges, the VA and DoD could utilize community organizations that have complementary data to gain access to a more complete picture of veterans' needs. So I guess the question is, what are VA and DoD currently doing to share data with community-serving organizations who have additional information not currently captured by DoD and VA systems, if anything? Yes, sir.
If I may, Senator, and I'm pleased that you're having the second panel here today, and they can foot stomp this. That's a new word I learned since I came into the VA. That there really is a connectivity and a sharing of data and information and perspectives around these issues, and what the VSO community is doing and what the community organizations are doing to work with us to provide the transition for our service members. So it's an exciting time to be able to partner with them and to share information with them and to watch them work with us and watch us work with them to serve our veteran community.
So did that come from Senator Tester? Or?
Well, Senator Tester is white hot smart, so I probably got that from somebody else.
Senator, if I could chime in on that.
Yes, sir.
As well, I think one of the great benefits of the electronic health records, and really what we're working on is through this benefits delivery discharge, as we can expand that program, is that more members will go and they'll get that. Right now, currently, or it has been in the past, is that you had to go, you get your separation physical at DoD, whatever branch you might be in, and then you go to the VA and have to get another physical, and that's how you get into the VA program. Really kind of moving forward with the programs that we have, or we're working on, is, and with the electronic health records, is that it'll just be a smooth transition, so that hopefully one day nobody will be missed, and everybody will just transition with their health record right from the active duty service into the VA. And I should not just say active duty service, but also our reservists and our guardsmen as well, those that are serving right from military service into the VA.
Right. Health is such an essential factor in the success of transitioning as a service member. Based on a 2010 study, female service members are 20 to 40% more likely to be diagnosed with breast cancer. Currently, what is DoD's current screening policy for transitioning members? And based on findings related to the link between toxic exposure and breast cancer, would you recommend DoD, or could you recommend DoD incorporate mammogram screenings during the separation physical?
Senator, I would, hopefully the physicals are a holistic approach when members are separating. I cannot comment exactly what the female record or the female examination is like, but I can take that for the record.
Yeah.
To see.
I would
what that
appreciate it
entails.
if you just follow up on that and make sure that that we're looking into that based on the study and the experience that we're seeing now, with these veterans.
Yes, sir.
Thank you.
Thank you, Senator Bozeman. Senator Blumenthal.
Thanks, Chairman Tester. Thank you for being here. Thank you for your service to our nation. I know this question is repetitive, but I want to make sure I hear it with my own ears. the current state of interoperability of the healthcare computer, software, electronic medical systems is now done, interoperable, working fine? If not, what are the problems?
If I could start, Senator Blumenthal, and then turn to my colleague. The legacy systems that both DoD and VA previously had some level of interoperability. We're now modernizing those systems and moving to a new electronic health system that's a modern system. And the goal of that system is that it be interoperable, that you have an electronic record that moves from point A to point Z. Once we get the system up and running, that's how it'll operate. But while we're modernizing, there still is a level of interoperability. And one of the things we talked about earlier.
There's some level of interoperability, but it isn't complete.
The two systems are at different points in time in their maturity and their deployment within DoD and VA, and the two new systems, I should say.
Do you agree with that, Secretary Cisneros?
Yes, sir. DoD should have its electronic health records implementation done completely by the end of 2023. And I believe, I'm not sure of the exact date, but the VA will follow after that.
Gentlemen, this is not a personal criticism of you, and I suspect others have made this point already, but I came to the Armed Services Committee and the Veterans Affairs Committee 10 years ago. And I dare say the answers you've just given me are slightly different, but not much from what I heard then. There's a new system in the works. It's just over the horizon, maybe a couple of years from now. In the meantime, we're trying to make the two work together. So I don't know enough about the software and the computers. I know that there have been new approaches, revisions, revisiting under different administrations, not personal to you, but I suspect at some point the VA and DoD computer operations will be a case study for a business school somewhere. And it's not going to be, this is how it should be. And I guess, Mr. Chairman, I raised this issue. We've all heard it. I know it's been raised in this hearing. I just wanted to hear it with my own ears, and I'm going to move on. I think we need to address this issue with the vigor and aggressiveness that it demands.
Senator, if I could just comment on this, it is, I feel very confident of the success that we're going to have in this. I'm very confident in this is going to be successful. And because basically we are using the same record. It is, it is the same system that DoD and VA are using. We are just in different, lines as far as the implementation goes. So it's not different systems like it has been in the past, trying to get them to talk together. It's the same system. And so there's no bit of not trying to get them to talk to each other because it's the same system.
Okay.
So I am confident that, unlike in the past, our electronic health records that we are working on right now will be implemented, and it'll continue it'll be make for a smooth transfer as to follow the service.
I appreciate that, and I'm interrupting you only because I want to move on to another topic, but thank you for that answer. The Solid Start program, which reaches out to servicemen and women as they leave, if they've had mental or behavioral health issues. The number I got was the VA has successfully connected with over 70% of veterans who engaged with a mental health provider during their last year of service. Does that include men and women who were discharged with less than honorable? Are they reached with the same frequency and thoroughness as the honorably discharged?
Senator, if I could respond. I don't know the data, and I can get back to you for the record on the data, but what I can tell you is that the efforts to try to reach those veterans are the same, to make sure that they have the mental health resources available to them.
I would be interested in more data on that program.
Yes.
I've introduced a measure called the Unlawful Turnaways Act of 2021, which would require the VA to conduct outreach to less than honorably discharged veterans in the same way that they do currently the honorably discharged. If you're doing it already, that would be great. I'm also co-sponsoring an NDAA amendment that will accomplish the same end. But in the past, as you know, it has been a problem for whatever reason. Maybe some of them just leave without the same kind of thoroughness of record keeping, but I'd be interested in any additional data that you have. I apologize, Mr. Chairman, for going over my time.
That's all right. Before we get to Senator Tillis, I just want to say that Senator Blumenthal is absolutely correct. Whether it was Obama or Trump or Biden, whatever these administrations are, we continue to have the same conversation, only the difference is we appropriate billions of dollars and still have the same conversation. If you guys get this done, we'll build a statue to both of you, okay?
And
because
one for Senator Tester, too.
That's right. Because of the generosity of the good senator from Alaska, I will call on Senator Tillis virtually.
Well, thank you, Mr. Chairman, and thank you, Senator Sullivan. Gentlemen, thank you for being here. I've got a real quick question. I signed on to a letter to you all about the impact the vaccine mandate is going to have. And I want to get down, and I suspect you're busy. We may not get a response to that letter in the time that we may feel some of the impacts. So can you give me some sense of, with both agencies now, I think, in or near the window to get the first phase of the vaccine, if you're doing a two-phase vaccine, can you give me an idea operationally where we're going to be in terms of people who are not vaccinated? And then secondly, what will be the policy for the unvaccinated? Will it be a separation, an unpaid leave of absence? What personnel policies are you giving out now? I assume that the departments have spent time on this because it's imminent in its impact on the labor force. And Mr. Remy, we'll start with you, and then Mr. Cisneros will go to you.
Thank you, Senator Tillis. We're at a point now where we're still gathering the data with respect to the responses to the surveys and the gathering of information around vaccinations. We have around 85% response rate for all of our employees that we've asked to provide information with respect to vaccinations, and we're continuing to gather more information that's coming in regularly.
So, Mr. Remy, I'm sorry to interrupt. 85% response rate, is that responding that they have been vaccinated, or just responding with a status of either vaccinated or unvaccinated?
I'm sorry, I should have been clearer. That's just responding to the survey of that group. We're gathering the data on how many have been vaccinated, how many have not been vaccinated, and why they fall into that category. What we're also doing, and if you may recall, our process started a little earlier for our VHA employees, who are those individuals that are providing healthcare services to veterans, and we've started our process in terms of what happens if they don't get vaccinated. Your question there of providing counseling and information to them. We have a progressive discipline process that, at the end of that process could result in separation from employment. But at this stage, what we're doing is we're providing counseling and information and education to those individuals who have indicated that they have been vaccinated, or to those people who haven't responded to the survey.
Okay, Mr. Cisneros?
Senator, our response is very similar to Mr. Remy's. Right now we are gathering the information as far as our civilian workforce, who's been vaccinated. We've created a form. We have got a process for them to get online in order to go and to register, in order to have them input that so the supervisor can approve it. Just as Mr. Remy said with the VA, we do kind of have a process as well for those that will not get the vaccine, a form of counseling that they have to, and then also different steps along the way as far as there may be a suspension before there may actually be
Okay.
termination.
I'm sorry, I do want to get to a couple of other policy questions. I think if you game this out, I met with a major defense contractor yesterday, and they're looking at either a high single digit or mid double digit reduction in force as a result of it. And I would guess that even after the counseling and the outreach, we are talking about a pretty significant potential reduction in force or leave of absence, whatever you come up with. So I'd be very interested, get a response to the letter to see how we deal with that operationally. Mr. Cisneros, I did want to ask you a question about the individual longitudinal exposure record and how important that is for information, health information that's in the DoD that could be very helpful if that information is available to the veteran with respect to toxic exposures. Is the system on track to receive or to achieve full capability by the September 23 date?
Senator, I know with the EILR program, the individual can go and they can request from a medical professional to see actual that form in order to, that will enable them to kind of have access to it in order to see it. I believe that the program, it is on track. It is on track right now, but that is a program that we will continue to work on and continue to improve to ensure that individuals have access to their information.
Okay, well, since the chair was gracious to recognize me, I'm not going to go over, but Mr. Remy and Mr. Cisneros, I will be submitting some questions for the record. One of them relates to the separation health assessments, and I got a couple of other things on collaborations with nonprofits with the VA, but I'll submit those for the record. Thank you, Chair.
Thank you, Senator Tillis. I'll take my first round of questions now. Think back, Secretary Cisneros, about Brown's question about, he asked if when folks are getting out of the military, if they're asked or talked to about toxic exposure. What I heard you say was no. On a personal basis, they're not talked about toxic exposure. There's work being done behind the scenes. But as far as the soon-to-be veteran, when they're leaving the military, they're not talked about toxic exposure. Was that the correct read I should have got from that answer?
Sir, they have access to the EILR, which would document whether or not they've been exposed.
Do they have the ability to change that EILR if they think they've been exposed?
They don't have right there to go in and process to get in there and change it. They can raise that up with the medical professionals and go through the process of doing that, but that's not something that can be done immediately.
Are they made aware of the EILR?
They are made aware of it, and
having the same issue? When processing claims related to MST, what's the biggest barrier that the VA faces in having the necessary evidence to evaluate the claim?
Thank you, Senator, for that question. And I'll also reiterate the reality that this is a high priority for Secretary McDonough and for the JAC in working with Secretary Cisneros. You know, one of the things we need to make sure that we have is data. We need to make sure that we understand the circumstances that an individual may have been in when they were on active duty, if they were if they're a survivor of military sexual trauma, the data associated with that, and any information that was provided in their discharge that might have affected their discharge, so that when we provide benefits to those former service members, now veterans, we can understand the landscape. And we've been working closely with DoD to make sure that we get that data.
Okay. We're going to switch to the Hannon Act. One of the provisions that I fought in the Hannon Act to include was the joint development of a strategic plan on the expansion of healthcare for transitioning veterans. It was meant to be a VA product with DoD input. The report was due more than 2 weeks ago. We were told that it would not be on time due to delayed concurrence from the DoD. Look, can either of you, number one, tell us when we're going to get the report? And number two, speak to why there was a delay. We've had the Hannon Act out for some time now. The reports are, I'll just be honest with you, the reports are necessary if we're going to do our job, making sure that Hannon is implemented. And Hannon passed by a good, solid margin. We've talked about suicide here a number of times. We've talked about mental health here a number of times. These reports may be a pain in the neck, but there's something that we need to get as a Congress and as a VA committee. So can you talk to me why we don't have it and when we expect to have it?
If I could start and then turn to my colleague, you should have it this winter in early 2022. And, you know, as Secretary Cisneros just mentioned, he's been on the job now for 2 months. I've been on the job now for a little over 3 months, and this is an issue that we're talking about, and we're trying to make sure that we get to you what you expect from us in responsiveness around the Hannon Act. And we know that it's in the process of finalization, and we'll get it to you soon.
Yes, Senator, you know, again, this is a very important piece of legislation, one that it goes into great detail. We are currently looking at a piece of the legislation right now, the one that goes into healthcare, if healthcare can be provided for a period of time after that. We should hopefully have that back to the VA as we're going through it in a matter of 2 weeks.
So that's good. He's going to have it back in 2 weeks. We should get it quicker than January, okay? The other thing I would just say is I don't know how you'd implement Hannon without a strategic plan, and this baby's been out for a while. Thank you. Senator Blackburn.
Thank you, Mr. Chairman, and thank you to you all for being here. Mr. Remy, let me come to you on FIRM and the implementation on that. We've talked a lot about the need to have that one centralized, single electronic health record to enhance patient care and efficiencies and effectiveness, and be certain that we have that data share, meaningful data share between DoD and VA, and working toward a seamless transition. And we think that's important for the care of the veteran. And we are now 3 years into a 10-year implementation. And at this point, there should have been 30 medical centers that had been put into the system. And right now, by the end of the fiscal year, the VA will have fielded one. So it seems to be plagued, absolutely plagued, by a true lack of concordance between the Office of Electronic Health Record Modernization and the Veterans Health Administration and the Office of Information Technology. And the rollout at the Mann Grandstaff VA Medical Center is an example of how mismanagement really puts lives at risk. So what I am hopeful of is that you and your team will step it up. And what I would like to ask you for is a written report on reorganization or changes to the governance structure, the removal of accountable personnel from some of the past failures which have been there in the rollout and implementation, and a new life cycle cost estimate for the program. And I would like to have that in 30 days so that we can look at this and see what it is that is happening with this rollout and with the mismanagement that seems to have just plagued this program. And we think the success is crucial, and I would like to ask your help on that.
Well, Senator Blackburn, this is something that I've been working on since the day that I got to VA. You may recall in the confirmation
I do.
hearing, it was something I talked a lot about. I can commit to providing a report. The one thing that I will note is the life cycle cost estimate that we're securing. It's an independent life cycle cost estimate being provided by IDA. It's going to take probably 9 to 12 months in order for them to provide it to us. They are the provider that knows the most about the electronic health record system, so that's why we went to them. But the other issues that you've described are issues that I've been working on since day one.
Okay.
And I do have a plan, and I'm happy to share
And
it
you're
with you.
happy to share that plan with us?
Yes, ma'am.
That would be great. And if we could get it in the next 30 days, I'd like to have that within 30 days. Is that possible for you?
With the exception of the life cycle cost estimate.
Yes, with the exception of the cost. But there again, we're going to have to go in and review that cost and look at what the overruns are going to be on that. Because obviously, if we were to have 30 by now and we've got 1, we're looking at some significant cost differences. And there will have to be a reevaluation on that. Okay, I want to ask a couple of things about the EILR. In your testimony, Mr. Remy, you mentioned that all facilities have someone trained on EILR. And so talk about what that functionally means, because we seem to get different, different assessments from different facilities.
Yes, ma'am. It means that the system is a system that's available to assure that we have the information around exposure and location during a particular time period. And we have people at all the facilities that know that that system is available and that can input the data.
Are they doing it, though?
That can receive the data. I believe that they are. It's an interesting question that I recognize I'd need to gather more data to provide to you, but I have no reason to believe that they're not utilizing the system the way that it was intended. In fact, some of the data that we have show that there's been an increase in usage of the EILR system year over year.
I think what we would want to look at is the ability of the functionality of the individuals that are doing that input, and then the ability for the Office of Electronic Health Record Modernization to use that data, making certain that it's something that is usable, that it's transportable, it's applicable, that it is usable. So we'll continue. My time is out, but I'll send you a couple of questions regarding that. Thank you.
Thank you, Senator.
Thank you, Senator Blackburn. Senator Sinema, virtually.
Thank you, Chairman Tester, and thank you to Ranking Member Moran for holding this hearing, and thank you to our witnesses. I'm particularly grateful that Thomas Winkle, the director of the Arizona Coalition for Military Families, is here to share the important work they've been doing to create a coalition of support for Arizona's service members, veterans, and their families. Like many of my colleagues on this committee, I continue to be very concerned about the number of lives that are lost to suicide. And the transition period can be a really challenging time. It's critical that the DoD and VA work together with community partners to best prepare service members and their family members for the transition. Arizona is a great example of what can be achieved when you focus on building relationships across community partners, the VA and DoD. Our efforts show that no one agency or entity can do it all, but as a network of support, we can have a great impact. So my first question is for Mr. Cisneros and then Mr. Remy. I've often found that family members and loved ones have a profound influence on service members and veterans, but can often feel left out of the transition process. That's why I introduced the Sergeant Daniel Somers Veterans Network of Support legislation. It was signed into law last year and establishes a program at the VA so transitioning service members identify loved ones who will get updates from the VA to help them feel better informed during the transition process. You know, transitioning out of the military can be a challenging time for service members and for the families who serve alongside them. And the more people who have the right information, the more successful that transition can be. So can you tell me what steps the DoD is taking with the VA to engage these family members to ensure that they're part of the transition process, and what more can be done?
Senator, thank you for that question. And look, you know, at TAP, family members have always been welcome to attend the TAP with the service member. You're right, it is important that the families are included in this process, and we definitely support that initiative and want to make sure that they have the information that they need in order to make sure, because it's not just the individual, it's the entire family transitioning out of military life into civilian life. And so, you know, we want to, as you stated right earlier as well, we want to make sure that we work with the MSOs and the VSOs to include that process and include the families. But family members have always been welcome at the Transition Assistance Program, and they will continue to be so.
And Senator, the same is true on the VA side. It certainly is the case that we recognize the importance of the family members in the transition, and we want to make sure that they're included in the process so that the transition can be as smooth as possible.
Well, Mr. Cisneros, the COVID pandemic has upended how we operate in our daily lives. Most notably is the increased reliance on virtual environments. Before COVID, only certain service members were allowed to participate in TAP and virtually. So that quickly changed when the pandemic started. So how is the program operating now? Is it all virtual, a hybrid model, or back to people in person?
Ma'am, that's the TAP classes are run at the installations, at the installation level, and that is, it's a variety that it's been doing, but no member should have ever been excluded from attending TAP. That is a mandatory for all members to go through TAP when they transition out of the military. And if that is something that was happening, that is definitely something I will look into.
Well, thank you. So following up, this question is for both Mr. Cisneros and Mr. Remy. What steps is DoD taking to understand the impact of the transition to a virtual environment for TAP, and what challenges or benefits are you seeing? Has this opened up participation for family members?
The virtual environment for TAP, ma'am, I'd have to take that for the record to look and see how many family members have actually participated in TAP when it was virtual, but that is something we can try and get some data on and get back to you on that.
And the same is true here, but you know, I will say that the virtual environment does currently exist for our veterans, as well as opening up in-person opportunities for people to gather information about what their benefits might be moving forward.
If I can make one more comment, ma'am, regarding the separation and the family members, it's a Military One Source, which is our website, as well as a 1-800 number that service members and their family members can utilize. They're authorized to utilize that after separation, up to a year after separation as well.
Thank you. Mr. Chairman, I have additional questions, but I see my time's expired. I'll submit them for the record, and I yield back. Thank you.
Thank you, Senator Sinema. Next is the very generous senator from Alaska, Senator Sullivan.
Well, thank you, Mr. Chairman, and I appreciate you and the ranking member holding this hearing. It's an issue that I care deeply about as a member of the Armed Services Committee. This committee is somebody who's still serving in the reserves myself, so I think it's really, really important work that the VA and the DoD are doing, particularly in the area of healthcare. So I wanted to get both of your views on some issues that relate to the integration, particularly Secretary Remy is the JEC co-chair, I think that your views are particularly important. So can you give me a sense, given your 4 months on board, on how you've dug into these issues of continued integration of the DoD and VA healthcare systems? You might recall I asked you a number of questions during your confirmation hearing. And what insights or lessons learned have you already seen in your position?
Thank you for the question, Senator. And one of the things that I've learned since I've been in the role is how that interoperability, that integration actually is effective both for our service members and our veterans. And what I mean by that is the ability of our service members to, for example, use our vet centers if they need mental health assistance, and the ability of our veterans, for example, to use our military hospitals in rural areas when that's necessary for them.
Good. I mean, I'm glad you mentioned it that way, because as we know, the goal here is better services for either our veterans with your organization or our military members, Mr. Secretary, with yours. So let me get to that. I have a bill that I've been very focused on. It's S2526 that would authorize the SecDef and Secretary of the VA to enter into agreements for planning, design, and construction of facilities to be operated as shared medical facilities. The VA, as you might know, Ms. Secretary, in the hearing just a couple weeks ago said they were fully supportive of this legislation. I want to know if either of you have looked at the example of the Lovell Federal Healthcare Center in North Chicago, which is really the only place in the country that has actually done this, believe it or not, and what lessons you may have learned from the successes and pitfalls from the VHA and DHA integration that has occurred there. I'd like either of you to take a crack at that. Go ahead, Mr. Secretary.
Senator, I haven't had a chance to go to the Lovell Center over there, and I believe it's in North Chicago.
Yeah.
But that is on my list of places to visit.
Good.
I believe it is a model that we can use for the future.
It's a model, no doubt, but it's not perfect. And what we want to do is the next time we do this is to learn lessons from that model. It's pretty good. It's the only one in the country. Let me give you an example of ones that I've looked at from that North Chicago facility. They still have restrictions on DoD physicians not being able to see VA patients, which kind of defeats the whole purpose. So have you had an opportunity to look, Mr. Secretary, at this model, lessons learned? Because my bill's already in the NDAA, this year's NDAA. So this is going to happen. And we want the VA and DoD to be ready when it does, with good thoughts and ideas on how to improve upon what we're doing in North Chicago.
Well, first of all, thank you, sir, for your bill, and we do, of course, support it. And secondly, I have had an opportunity, and I know that our teams have had an opportunity to look at the model in North Chicago.
Good.
In fact, just last week we had a meeting to talk about how we can look at this model and maybe move it into other locations, but understand first what the challenges might be.
Good, and what are they? I mean, if you can give us
you've just identified one, but the other is the joint use of the facilities. This is where your legislation is going to be incredibly helpful to both DoD and to VA in making sure that we can acquire facilities or lease facilities that are necessary in order to do this work.
Good. I plan on hosting Secretary McDonough up in Alaska next month, and we're going to be doing a lot of discussion on these topics. I'm going to bring some of our facilities, but it's an area that I think we could really improve on. Let me, one final question. Secretary Cisneros, can you give us an update on the situation with vaccines, the vaccine mandate, and the military? And I have concerns about that, but what I really have concerns about is somehow, service member serving his country for years and doing a great job, and then having this end their career or somehow getting a bad conduct discharge or something like that, which I would totally oppose. What's the thinking right now? I know it's a fluid issue, but can you give us an update? It's important.
Well, sir, the first thing is I'm happy to report that our active duty forces are getting the vast majority of them have gotten the vaccine. I believe the number was over 97% today that we reported. The Navy is over 99% of their active duty force has gotten the vaccine. So the service members see the importance of it. As far as discharges or those who might refuse, they can ask for an exemption, either whether it be for medical reasons or for religious reasons. But that as, discharges and what that'll be is left up to each individual service as to how they will approach that.
Okay. Thank you, Mr. Chairman.
Thank you, Senator Sullivan. Thank you, gentlemen. Appreciate your testimony. We'll move on to the next panel now. But thank you very much. Appreciate you being here.
Thank you, Mr. Chairman.
You bet. We're now going to hear from some community organizations who work in partnership with the VA and the DoD to serve veterans. Today we have with us Dr. Nicholas Armstrong, Managing Director of Research and Data at Syracuse University's Institute for Veteran and Military Families. We have Mr. Mike Hutchings, Chief Executive Officer of Combined Arms. We have Mr. Thomas Winkle, Founder and Director of the Arizona Coalition for Military Families. Appreciate all of you being here. Dr. Armstrong, we're going to start with you.
Mr. Chairman, I'd like to start by offering my condolences to Senator Rounds and his family. Good afternoon, Chairman Tester, Ranking Member Moran. Members of the committee, I'd like to thank you for the opportunity to testify on the topic of collaborative efforts between the Departments of Defense and Veterans Affairs to improve the military to civilian transition. I'd also like to thank you for all the important work this committee has accomplished over the last few years. In addition to serving as Managing Director at the Institute for Veterans and Military Families at Syracuse University, I'm a veteran. I served 8 years in the United States Army, including nearly 3 years deployed in Iraq, Afghanistan, and Bosnia with the 10th Mountain Division. Upon my separation, I attended Syracuse University as the university's first post-9/11 GI Bill student and eventually earned my PhD. All this is to say, I understand transition not only because I study it every day, but because I also lived it. I know firsthand how critical it is that we as a nation get transition right for our service members and their families. Therefore, I'd like to start with a statistic. In 2018, the combined funding from DoD, VA, Labor, and the Small Business Administration devoted specifically to the Transition Assistance Program was approximately $182 million. With roughly 200,000 members separating from active service each year, this equates to an investment of about $910 per veteran. I say again, $910 worth of transition support for each exiting service member. This contrast seems stark compared to the tens of thousands it costs to recruit and screen a basic trainee, and the over $200 billion spent annually on post-service health, wellness, and benefit programs. It's stark considering that research consistently shows a strong connection between a positive transition experience and better health and well-being outcomes later in life. Conversely, a negative transition experience can linger for decades, sometimes spiraling into the most devastating outcomes such as homelessness or suicide. Even VA researchers have coined the initial period after separation as the deadly gap, when transitioning service members are more likely to die by suicide than others. To improve the transition experience, the DoD and VA must further integrate their efforts. However, this task is bigger than the VA and DoD alone. In fact, it is bigger than the entirety of the federal government. Supporting transition is a whole-of-the-nation task, one that government must lead, but in close partnership with the nonprofit and private sectors. This committee and those who serve in the VA and DoD have made great progress. Last year marked historic legislative achievements. Legislation like the Hannon Act and the Phil Rowe and Johnny Isaacson Veterans Health Care and Benefits Improvement Act have the potential to significantly improve the way DoD and VA support transition. I want to thank you for passing this legislation and for all the work this committee, the VA, and DoD are doing to ensure implementation of this legislation is both effective and timely. Still, there is more work to do. As you will see in greater detail in my written testimony, I believe there are 3 major ways we can improve collaboration between the DoD and VA to improve the transition experience. First, we must take legislative action to create a permanent national veterans strategy and expanded interagency process. The Joint Executive Committee and this administration's Joining Forces Initiative are good blueprints for a permanent interagency council positioned to spur broader whole-of-government collaboration between the DoD, VA, and other agencies. However, these efforts cannot wax and wane across administrations. They must endure. Congress should take action to make permanent an elevated and expanded interagency mechanism with the power to set and execute a national veteran strategy that evolves with the changing needs of veterans and their families and actively integrates with the nonprofit and private sectors as partners in these efforts. Second, we must enhance collaboration and coordination between the DoD, VA, and local communities. Ultimately, policy becomes reality in the communities where veterans live, work, and raise families. Community collaboration at VA medical centers and DoD installations often depend on local leadership. With congressional authority, VA and DoD can do more to enhance local engagement with community social service providers to integrate health and social care for transitioning service members and veterans. Third and finally, we must expand credentialing and job training offerings through public-private partnerships. Job training and credentialing programs must be available to transitioning service members and their families regardless of where they transition from. The nonprofit sector has made great strides in providing job training services inclusive of family members, but nonprofits need continued investment to scale sustainably. Public-private partnerships, including financial investments on behalf of DoD and VA, can expand equitable access to these services. Serving the veterans of tomorrow requires us to improve the transition process today. Ensuring an all-volunteer force for our nation's future requires us to set transitioning service members and veterans up for success in the present. Action is required and success is in our reach. Thank you.
Appreciate your testimony, Dr. Armstrong. And now we'll go with Mike Hutchings, virtually.
Chairman Tester, Ranking Member Moran, distinguished members of the committee. Thank you for this opportunity to discuss how collaboration among the VA, DoD, and through multi-sectoral partnerships can improve outcomes for service members and veterans. I'm excited to report that in Texas and in various parts of the nation, community collaboration with the VA has never been stronger. It's stronger because local VHAs and VBA leadership understand the value that additional resources and member organizations can bring to the shared mission of improving the veteran transition experience, advancing health outcomes for veterans, and most importantly, preventing veteran suicide. Composed of other government agencies and local, regional, and national nonprofit organizations, Combined Arms 177 member agencies serve as effective force multipliers for VA and DoD programming and customer service. We're able to fill gaps in the programming through our network of trusted providers. We execute interagency referrals between government agencies and nonprofits, and we provide increased client enrollment in VA programs. While the DoD and VA in collaboration can provide A through F with transition support services, it is community-based organizations like Combined Arms that can fulfill G through Z or serve those ineligible for VA services. Working in tandem enables a complete continuum of care, and Combined Arms stands ready to scale existing programmings and partnerships to meet the ever-evolving needs of our veteran and military families. Combined Arms operates its innovative collaborative system through 4 major pillars. We've created an integrated technology platform that ensures veterans have access to thousands of social services provided by our vetted member organizations. And we flip the accountability from the veteran to the service organization by requiring all member organizations of the collaborative respond to veteran requests within 72 hours or less. We've deployed a white label technology referral platform to veteran nonprofit hubs and collaboratives across the nation. Currently, Combined Arms technology platform is live, empowering projects or veteran hub ecosystems in 26 states. We've also created and developed an interagency referral tool called Check-In. This application is available via desktop and mobile and can refer a veteran to an organization in the collaborative in less than 30 seconds. We also have a Texas-based transition center, which serves as a co-working space available to all of our member agencies and creates intentional collaborative collisions for organizations that serve veterans. Partnership collaboration and large-scale convening of resources are the cornerstone of our methodology and success. I'd like to highlight a handful of our partnerships with federal entities that have yielded increased collaboration among organizations and, more importantly, better care for our nation's veterans. 15 different VA programs and clinics at the Michael E. DeBakey VA Medical Center have been assigned to work within the Combined Arms system. This partnership allows the VA to utilize our system to refer veterans to nonprofit agencies delivering social services not provided by the DeBakey VA. Similarly, Combined Arms member organizations and Combined Arms can refer veterans into the VBA and VHA programs at the DeBakey Center. We work with the Department of Labor, Veterans Employment, and Training Services Navigator and Partnership Pilot since September of this year to directly connect transitioning service members and spouses to quality employment and training resources. And since launching the Texas Veterans Network in April of 2020, we've established a regular presence at all the major military installations in Texas. Each visit allows Combined Arms the opportunity to demonstrate the importance of community-based resources as well as how to connect transitioning service members to our technology. To ensure that no service member falls through the cracks, Combined Arms should be included in transition workshops or transition checklists, which would encourage the service member to create a Combined Arms profile prior to separation. In summary, Combined Arms has developed, perfected, and scaled a downstream model to directly connect veterans and military families with organizations that serve them. By having federal, state, and community-based organizations working in closer collaboration, we can accelerate and streamline transitioning service member and veteran access to critically needed resources, which will help prevent unemployment, underemployment, substance abuse, family challenges, homelessness, criminal behavior, and in turn, save veteran lives. Thank you again for your consideration of this testimony and for your continued service to our military and veteran community.
Thank you for your testimony, Mr. Hutchings. Mr. Winkle. Also virtually. Mr. Winkle?
All right, you got me?
We got you.
Outstanding. Thank you, sir. All right, thank you, Chairman Tester, Ranking Member Moran, Senator Sinema from Arizona, and members of the Committee of Veterans Affairs for inviting a simple mud Marines to speak today. As a veteran, I'm heartened by the question before this committee. Why? Well, because in Arizona, we have an incredibly strong, nationally recognized partnership with the VA, military installations, the Arizona Department of Veterans Services, and the community. And through all that, we have built an ecosystem of support to do what none of us could do alone. It is my strong belief that every state's service members, veterans, and their families should have the same sustainable, robust ecosystem as Arizona's or better. In my 12 plus years in working in this field, I have seen the VA and DoD grow in their collaborative efforts with each other and with the community to address some of the most complex challenges. So what does the VA and the DoD need in order to accept the community as an equal partner? Well, they need the legal authority and framework to partner, and they need the state and community partners that they can trust, that have stability, and that have data-driven approaches. In Arizona, that community partner is a collective impact initiative called the Arizona Coalition for Military Families. With over 450 truly vetted partners and over 3,000 resources, we've served over 60,000 veterans, service members, and their families. Here are some examples of our collective effectiveness. From 2008 to 2010, the Arizona National Guard had 3 consecutive years of the highest number of deaths by suicide in the history of the organization. The coalition was asked to assist with a solution. We included the VA and other community partners. There were 0 suicides for the 3 years the program was in operation. In 2016, the Clay Hunt Suicide Prevention Act opened a door for the VA to collaborate with the community in a more comprehensive way. We created the Be Connected program, which uses the lessons learned from the successes of the National Guard program for a statewide focus. Appreciation goes to the late Senator John McCain and Senator Sinema for their support of this effort. In 2018, all 5 of our active duty bases and other key stakeholders signed a DoD SkillBridge program MOU. The result is an average post-SkillBridge salary of over $70,000. In 3 VA health centers are a part of the Be Connected, so we have this continuity of care throughout the state. Directors of our 3 Arizona VA healthcare systems have shared that statewide partnership helped them work more effectively with each other during COVID-19. These and literally hundreds of other examples are what we get when we include the community as an equal partner. The VA and the DoD should have an organization in every state that they can fully trust. Fortunately, there is a collaboration already taking place that supports this. SAMHSA and the VA have an effort called the Governor's Challenge to Prevent Suicide. Governor-appointed teams comprised of the military, government, and community receive an extensive amount of technical assistance on best practices. Arizona has been part of this project for over a decade now and has been instrumental. Given that we have this pathway available, I have recommendations here and in my supplementary material. For the Senate, please authorize the DoD to update the joint ethics regulations so that they can engage more easily with established public-private partnerships. For the DoD, add the Governor's Challenge team efforts to the list of sanctioned public-private efforts so that the base commanders and personnel from family programs, suicide prevention, and TAPS can more easily engage. For the VA, the Governor Challenge effort needs to increase the emphasis on building collective impact initiative models or other such models and fund their staffing and program needs with the Staff Sergeant Parker Gordon Fox Suicide Prevention Program. It was the original iteration of that. Include input on the Governor's Challenge grant process from the National Association of State Directors of Veterans Affairs. They're waiting for you. Utilize the CDC and the CDC Foundation work with the state scorecard, the vulnerability index, and the Warrior Built effort to assist the Governor Challenge teams. Ensure that the community veteran engagement boards, the CVEBs, are incorporated fully into the Governor Challenge teams. Increase efforts with qualified research institutions like the Arizona State University and Syracuse IVMF to track and report data for those Governor Challenge teams. I'd like to recognize Governor Doug Ducey and the Governor's Office for Youth, Faith, and Family, and also the leadership of the Arizona Department of Veterans Services, Vision 22, Arizona's 3 VA healthcare systems, and the Regional Benefits Office for their ongoing partnership in supporting all service members, veterans, and their families. Chairman Tester, Ranking Member Moran, and members of the committee, I appreciate the time to speak.
Yeah, thank you, Mr. Winkle. I want to thank all three of you for your testimony. I'm going to go with Senator Moran now.
Chairman, thank you very much. And thank you to our three witnesses. Thanks for joining us. Mr. Winkle, let me begin with you. I've met you, and it's nice to see you again, although it would be better to see you. I would enjoy seeing you in person. Thank you for your service as a Marine and your continued service for other veterans. I continue to hear about how good ACMF is as an example, how to maximize the community involvement in partnerships with our veterans, particularly as it relates to transition. Let me ask this question. As part of the team that designated and implemented the ACMF in 2009, what startup best practices can you share with members of this committee who don't yet have an organization like yours in our states?
Really appreciate it, Senator Moran. Yes, I look forward to seeing you in person as well. And so I think, you know, one of the biggest things I would recommend is contacting the governor teams, ensure that they understand that the community is really the third leg of the stool that supports service members and veterans and their families. It's incredibly important. Without it, you've got a wobbly stool. I mean, you know, there's lots of analogies for that. But the reality is, with a senator on their side as a champion, you can encourage them to go big with their efforts. This is really tough work. And so they're going to need folks in their corner, if you will. We were incredibly fortunate back in 2008 to have that type of support, and we've benefited from it ever since.
With the John Q. Hannon Act implementation, as we highlighted earlier, we need a number of steps to occur so that implementation can be more quickly accomplished. But it creates partnerships with, let me say it differently, it gives opportunities for not-for-profit organizations at home communities the opportunity to engage in the efforts to reduce the number of suicides, eliminate suicide, and provide mental health services within a community. I think it's one of the best features of the many good features in that act. And again, it highlights what we believe we can do as we further engage local organizations, local communities in the well-being of those members of their community who serve the nation. So I think this whole issue of this effort at home becomes even more important. You mentioned Mr. Winkler, the DoD ethics regulations that create barriers in these partnerships. Would you highlight or elaborate on what you're talking about? What's an example so I can fasten it in my brain?
Well, I appreciate this question as well, Senator Moran. First of all, I'll say the joint ethics regulation is really important. It is needed, in essence, to be able to protect the military from getting too far into the weeds. There are some organizations out there that don't always practice the best practices that are available, and it has a variety of other uses. So I don't want to eliminate it by any stretch, but when we have had pushback from the bases, and now I'm going back 13 years, we do not have that experience anymore. I'll say the bases now are fantastic, and we worked with all different levels up down the chain of command. It's amazing, really, and eye-opening. But in the past, it has been used, and I worry about my other fellow states, to block, in essence, efforts to come on base or to do good work. The actual National Guard program that I mentioned, where we ended suicide for over 3 years, there were some wonderful proponents of it, but there were also archaic thinking that was going along. One of the individuals that ended up being able to use that joint ethics regulation to push us out, if you will, was quoted oftentimes as saying that suicide was just kind of a natural condition of training, and that we should expect a couple of suicides a year. And so, with that level of thinking and then being able to use that as a block, it creates some real difficulties for programs. I've got plenty of other examples of that. Fortunately, in Arizona, they're all in the past, but now I worry about my fellow states.
Thank you very much. Dr. Armstrong, thank you for your service to our nation and to other veterans. Congress has looked for ways to include community organizations in the transition process. And as we've looked to overhaul the military to civilian aspect of that transition, your organization, IVMF, has always been a relevant and key player in those discussions that we've had. And I think I was always interested in the relationship, the working effort you have with Syracuse University and veterans groups to craft those opportunities for that transition to be better. Can you lay out for the committee the ongoing gaps that you see in that transition process when it comes to collaboration between organizations like yours, federal agencies like DOL, VA, DoD, and veterans and military service organizations? How do we get it all to come together?
Thank you, Senator, for that question. It's really a question we've been tackling from the very beginning as a research center. We've looked to different research in terms of what the needs are of service members in transition, and often navigation rises to the top among other needs, particularly with respect to employment. But trying to knit together all the sea of goodwill, both the programs that are offered by government, but also by the nonprofit sector. And so trying to pull that all together, we see, in my testimony, as one of the leading points is around driving toward the creation of a national veterans strategy and an expanded process that pulls in other federal agencies, states and local governments, as well as nonprofit and private sector, and all the investment in that sea of goodwill to align that work to make it more accessible to those further upstream in helping provide that access even before service members take that uniform off and transition into their communities.
Thank you for your efforts and for your answer. I may borrow sea of goodwill as a phrase I'd like to use. I like it. It expresses a circumstance that certainly exists. Thank you.
Thank you, Senator Moran. I'm going to start with you, Dr. Armstrong. When you transitioned out of the military, I don't want to date you, but when was that?
It was 2007.
Okay. And so what was your personal experience with that transition? And the next question is going to be, how have they improved and what do they need to improve upon? I'm talking both from a DoD perspective and a VA perspective.
Thank you, Senator. So my experience was almost an optional set of potential transition workshops, things of that nature. frankly, it's hard to remember because it was such a blur. Because the experience, and I think many others in transition would often relate to this in the sense that it often happens quickly. In the sense that like having access to information about, like you're so ready to transition into your next role in life that sometimes you miss some of the key information, whether it's related to benefits or things that you'll need when you arrive in your local community. Certainly, a ton has helped, has advanced with respect to the Transition Assistance Program. And certainly organizations like ours, which run programs that are complementary to the Transition Assistance Program, like programs like Onward to Opportunity, which is a career training program that we operate on 19 military installations, actually with access to another 45 or so installations that provide access to industry, in-demand industry-specific training and credentialing opportunities that help to enhance that transition assistance program experience. Certainly, that's been a huge advancement from what was not available when I transitioned personally.
Okay, so you've done some work with SkillBridge.
Yes, sir.
Can you tell us what is required to provide access to SkillBridge on a new base?
Early on for us, it was finding local leadership buy-in to help us bring our program onto the installations.
Military leadership?
Yes, sir.
Yeah. Okay. And do you find that the military is, and I don't want to get you in trouble, but do you find the military is open to things like SkillBridge, or is it kind of a pain in the neck?
Very open, Senator. Yes.
Okay. Good. Good. Is there anything we need to do with SkillBridge to make it more effective?
Senator, yes, I think it could be more effective in the sense of providing more equitable access to those in transition. So our program, for example, I mentioned we operate that program on 19 military installations. That's been a function of initially local base leadership willingness to help us come on base to provide access to that. But certainly with resources of being able to expand those offerings, we do offer the program online and have actually seen a huge uptake in terms of both service members, those from the National Guard and Reserve, and military spouses take advantage of that. But in terms of scale, it's a matter of resources, and we deliver the program at no cost because these programs are largely funded by private philanthropy.
So this question is for all three of our witnesses that testified on the second panel. The credentialing programs are an important tool in ensuring that transitioning servicemen have, service members, I should say, have in-demand skill sets to meet the changing needs of employers. The military services also have credentialing programs that allow service members to attain employment credentials outside their transition window, including on-the-job training for credentials related to their military occupation. So, and we'll start with you, Dr. Armstrong, go to Mr. Hutchings and Mr. Winkle. Are your organizations seeing an impact in the transitioning veteran population from these credentialing programs that are outside the transition window?
Thank you, Senator, for that question. I can speak to our program in particular. We are seeing impacts for those programs. We have a robust data collection and measurement and evaluation approach to the program itself. So we are capturing outcomes as transitioning service members not only complete the programs, but when they take and sit for certifications. And we also follow up with them at 6 and annual intervals to understand their employment status. And we can report retention rates close to 80%, which is very good compared to many industry benchmarks. I'll pass that on to my colleagues.
Mr. Hutchins.
Thank you, Senator, for your question. Over the past year and a half, we have seen a slight increase in veterans coming into the combined arms system with additional credentialing that we hadn't seen in the past. Some brief examples of that would be certification while in the service in Yellow Belt, Green Belt, Lean Six Sigma programs. We've seen some SAP credentialing software style certifications that have happened as well. So it is something we have noticed over the past year and a half, 2 years, and ultimately it does help make them more competitive in the civilian marketplace as they seek to gain employment after their time in service.
Mr. Winkle.
Yes, certainly, Senator. We've seen a massive impact on it, actually. Upskilling is huge. We use O2O, Onward to Opportunity, and a variety of other things, including programs from DOL and WIOA to help folks become higher certified. And when we're talking about just that wedge of individuals, I had mentioned $70,000 for this overall SkillBridge. Well, those tend to range when you're looking at the upskilling elements of it between 81,000 up to 144,000. So it's having an impact on the service members' lives. Yes.
Mr. Winkle, you might as well stay on. I want to talk to you a little bit about the suicide program that you had as it related to the Arizona National Guard. They went from many suicides to 0. That's pretty good success. In fact, that's really good success. You talked about the different entities involved, but what did you really focus on to get that to 0? Was there any one thing that you focused on, or was there multiple things? And if there were multiple things, what were they?
Wonderful question, huge question. I'll attempt to answer it precisely. Technically, we went after the culture, and that included things like leadership support, sincere leadership support, engaged leadership support. We had a variety of different programs. We retrained everything, so we had prevention, intervention, and postvention. The blessing of it is we never had to use the postvention. We were only using the prevention and the intervention modalities. We did a ton of training. So the Guard was about 8,000 strong at that particular point, 8,500 maybe. And we trained every single person in a couple of things. And then we trained, kind of worked it up the ladders so that by the time we got to the chaplains and first sergeants, things like that, they were all assist trained, which was an excellent addition. There were some wonderful programs out of the Joint Chiefs at that time, comprehensive soldier fitness and master resilience training. And we just flooded the market. I think we had a total of 700 folks trained in Master Resilience Trainer. They ate it up because they saw that it worked, and it not only stopped the suicides, but it improved their overall general lives and their functioning and things like that. That was upstream suicide prevention.
So, Mr. Winkle, you dealt with these folks while they were in the Guard. Is that correct? Or
that is correct. Yes, Senator.
Can any of the three of you speak to the connection between successful transition, meaningful employment, and veterans' mental health? And I'm speaking after transition on these. Go ahead, Dr. Armstrong. I see you pushing.
Thank you, Senator. I can speak to meaningful employment being a protective factor specific to suicide. And so we see the, helping folks transition, particularly with a focus around employment, while there are many social needs that folks may have in their transition, both themselves and their family members, securing employment, and also anecdotally for their spouse, having employment at the point of transition also are very important buffers from both a mental health and suicide prevention standpoint.
Thank you. The other two panelists like to respond to that. You don't have to, but if you want to, please do.
Yes, Senator. I'll highlight something specific from our data. So since, really 2017, Combined Arms has served over 50,000 unique veteran and military families through the system. And the three most requested resources that we have looking at all of our data points is number one is employment, career search and placement. Number two is social connectivity. And number three is volunteerism. Those are the three most requested things from the data points in our system. That's showing and telling us that veterans, as they're a transitioning service member, as they're transitioning, their focus is getting a job, connecting with their tribe, like-minded individuals, people they have shared experiences with, and giving back to their community. So veterans are truly economic assets, and they want to go back to the communities that they left long ago and have an impact on those communities and help with the overall betterment.
I think, Senator, I would probably just throw in that we look and work a lot with the Thomas Joyner's theories on suicide and suicide prevention. And what he's looking at are things like familiarity with lethal means. Okay, well, you know, everyone in the military is familiar with those, with weapons and how to handle them, and used to the concept of death and putting themselves on the life on the line. The other two things are a sense of belongingness and a sense of burdensomeness. And so we directly go after those as well in both our statewide program and back when we were working with the National Guard. Belongingness, that's tribe and all that other, you know, wonderful words. And then burdensomeness is, you know, are there people reaching out to me? Are there folks that, you know, are interested in helping me? The VA and the DoD's outreach and attempts to support service members is valuable to folks that are struggling.
Thank you, guys. Thank you for all you do. I appreciate it very much. I want to thank both panels for their words today. Look, we've got challenges out there, but